Hello, everyone. This is question 43 of our 100 clinically oriented anatomy questions. So let's jump straight into it. The question says a 24-year-old female received a small caliber bullet wound to the popliteal fossa from a drive-by assailant. The patient was admitted to the emergency department where the surgeons recognized the bullet had severed the tibial nerve. Such an injury would most likely result in which of the following? So it is. Let's discuss the tibial nerve before we even check the options. The tibial nerve is branches off from the sciatic nerve, and then it supplies majorly the posterior compartment of the leg. That is the muscles in the posterior compartment of the leg. And the muscles in the posterior compartment of the leg are responsible for plantar flexion and inversion. Yeah, tibialis posterior inverts the foot, so it's a major inverter. So, and it's in the posterior compartment of the leg innervated by the tibial nerve. So plantar flexion is going to be lost and inversion is going to be lost. So it means that opposite of what is lost is what we will see. Plantar flexion is lost. It means that the foot will be dorsiflexed. We cannot plantar the patient cannot plantar flex. It means the patient will dorsiflex. That is, they didn't mention that the anterior compartment was affected. Anterior compartment is responsible for dorsiflexion, while the lateral compartment is responsible for eversion. So they didn't mention that the common peroneal or the deep peroneal or the superficial peroneal. They didn't mention that any of these nerves was affected. So it is the tibial nerve that was affected. It means plantar flexion will be lost. And when plantar flexion is lost, it means the foot will be naturally dorsiflexed. Inversion will be lost. It means the foot will naturally be everted. So the correct answer is supposed to be we are. So what are we going to see in the patient's foot? The patient's foot is going to be dorsiflexed and everted, and that is option C, and that is the correct answer without stress. So the correct answer is option C. So let's check the other options and let's see why they are wrong. So inability to extend the leg at the knee. Extension of the leg at the knee is brought about by the quadriceps femoris, and they are innervated by the femoral nerve. Foot drop is an injury to the deep peroneal nerve, which is loss of dorsiflexion basically. So option D, a plantar flexed and inverted foot. The plantar flexed and inverted foot is basically telling us foot drop. So that is injury to the deep peroneal nerve, and that's not what we have here. So option E, total inability to flex the leg at the knee joint. So now flexion of the leg at the knee joint is going to be lost, but it's going to be partially lost. It's not going to be totally lost. Why is that? Because the gastrocnemius and the plantaris cross the knee joint and they help in flexing the knee joint. They help in flexing the knee joint. They are not the major flexors of the knee joint. So the major flexors of the knee joint are the hamstring muscles, and then they are not affected in this case because they are not even in the posterior compartment of the leg. They are in the thigh. They are thigh muscles, posterior compartment of the thigh, and they are innervated by the sciatic nerve. So the tibial nerve was injured at the popliteal fossa, so it does not affect the hamstring muscles. It means flexion of the knee joints will still be possible, but of course, it will not be totally possible. Like as in a normal person, that the tibial nerve is still like intact. It will be lost, but not totally lost, because the hamstring muscles are the major flexors. The gastrocnemius and the plantaris will be affected since the nerve that supplies them is already injured. But they are just helpers. They just help in flexing the knee joints because they cross the knee joints. They are not the major flexors. So it means it will not be total inability. It will be more like a partial inability to flex the knee. So the correct answer is option C. I believe you understand that, and I'll see you in the next episode. Thank you.